Good afternoon, everyone. It is 2 o'clock. My name is Kara Cleveland, and I'm the supervisor of the Indiana State Library's Professional Development Office. I will be the host and question moderator for today's webinar, Mental Health First Aid and the Library Work Culture, presented by Loren McClain from the Muncie Public Library. I want to address a few housekeeping items before we start. If you are having sound issues during the webinar, please see the sound issues box just below the chat box. If there's a global sound issue, we will announce it in the chat box. If you are unable to resolve the sound issue you are experiencing, we are recording the webinar and you can watch it offline after it has ended. Again, if there's a global sound issue, we will make an announcement in the lower chat box. During the webinar, if you have a question, just type it in the chat box on the upper left side of the screen. I'll be watching and will get your question to Loren as soon as there's a good opportunity. There should also be time near the end for questions. The session today is worth 1 LEU, and your certificate will be available for download at the end of this webinar. Also, today's webinar will be recorded and archived. After the webinar has been transcribed, it will be available on the Indiana State Library's Archived Webinars page. For weekly updates on upcoming trainings and to learn more about what's happening in libraries across the state, please subscribe to the Indiana State Library's e-newsletter called The Wednesday Word. And check out our continuing education website for other professional development opportunities. Okay, let's get started. I am now happy to turn the presentation over to Loren.
Thank you for that, Kara. Hi, everybody, and good afternoon. Thank you for showing up. I know you take a lot of time out of your schedules to view these webinars, so I'm greatly appreciative that you took the time to view mine. A little bit about me. I work in human resources at the Muncie Public Library, and I'm a National Certified Mental Health First Aid Instructor. I have all 9 module certificates, so this is a very dear avenue to my heart where I think it's very important that we actually talk about mental health first aid and how that impacts us. So let's go ahead and get started. If at any time you have a question, as Kara said, drop it in the chat box and I will try to get to it as soon as possible. So why are we here? Author Patrick Ness once said, "Librarians are tour guides of all knowledge." This particular quote illustrates the unmatched level of service provided by our profession. Some members of the public are easy to help, and others can be more difficult, such as those living with a mental illness. So how can we better be tour guides for these individuals? The answer, I will say, does not come easily or even as a whole. It is more fragmented than one would like to admit, but by piecing together information and resources, we can obtain a better level of understanding how to help our communities. Passion leads us here. We would not be watching this webinar or me presenting it if we did not have some personal interest or attachment to the topic. Awareness. We all like to bring awareness to situations, things that have plagued our society that are becoming more rampant and apparent. And education. So, as education, this goes without saying, the more we can educate ourselves and others on the topic of mental health, the easier time we have in providing information and services to our patrons and staff. Secondly, we have to understand that as a frontline resource, not only to our communities, but to our own workforce culture as well, we strive to provide information and services to strengthen our relationship with people who live with and without mental illnesses. While it's helpful to have a basic understanding of mental health disorders and symptoms, it's not a role to try to diagnose people or a mental disorder based on a person's behavior. However, libraries and staff should focus on learning appropriate responses to behaviors. For instance, knowing when to use a de-escalation technique rather than calling 911 instantaneously. This leads us to ask 2 new questions. What is mental health? Take a moment to think how you define mental health. What are some words that come to mind when you think of mental health as a general phrase? Oftentimes, instead of a definition, we are confronted with an image of a mental health issue, or at the very least, an image of someone we have been conditioned to associate the words mental health with. When I ask this question during my mental health trainings, I get answers that range from, the stereotypical, the crazy bag lady you see pushing the cart of her wares down the street, or, the guy with schizophrenia. The type, the ones you see on the news. One of the things we have to do is reflect on our personal biases in order to be able to react appropriately when confronted with what might be an uncomfortable situation. You never know what may be happening to these individuals to cause them to be in their current situation. Also, you cannot assume that because they look a certain way that they have a mental illness or simply will behave a certain way. To define mental health, we should actually focus on positive rather than negative attributes. Work-life balance. A good work-life balance leads to positive mental health. The ability to cope with stress. We all have everyday stressors, things like that. It's when those stress becomes extreme that it turns into anxiety. Physical, mental, and emotional health, all three combined play a role in mental health. That becomes behavioral, emotional, even just your psychological well-being. A lack of mental illness. Some people think, oh, good mental health means you don't have a mental illness at all. I think that's highly contrary, and that shows one's own personal biases. Having been there myself before being diagnosed with anxiety and depression, I always thought, I'm the picture perfect, ideal of what mental health should be, and then I realized, oh, I actually have some issues that I need to work through and get help for. So what is recovery? Recovery depends on the person. You cannot define recovery for somebody else. So for some, this is the ability to live a fulfilling and productive life despite a disability. For others, recovery implies the reduction or complete remission of symptoms. And mental health recovery is the process in which people are able to live, work, learn, and participate fully in their communities. So when we think about recovery, think about what positive steps people are making. We do not want to see mental health or mental illness as a handicap. I'm going to use air quotations around that word. That's a stigmatizing word. We use the word disability to cause a disruption to the ability to do something. So, what is a mental health disorder or illness? How do we define that? A mental illness is a mental disorder that is diagnosable, affects a person's thinking, emotional state, and behavior, disrupts the person's ability to work, carry out daily activities, and engage in satisfying relationships. These are the three primary things we need to look at when talking about mental health disorders and illnesses and just positive mental health in general. A mental illness is a mental or behavioral emotional disorder diagnosable currently or within the past year. Mental disorders include eating disorders and substance use disorders in addition to depression, mood disorders, and anxiety disorders. Mental illnesses cause disruption of ability, so we aptly name this a disability, not a handicap. Mental illnesses can be more disabling than many chronic physical illnesses. For example, I'd like to explain that the disability from moderate depression is similar to the impact from relapsing from multiple sclerosis, severe asthma, or chronic hepatitis B, and also the disability from severe depression is comparable to the disability from quadriplegia. Oftentimes, we do not see physical disabilities on the same level as mental illness because, one, we can physically see. We can say, oh, they have a cast on their leg, something must have happened, how can we accommodate that? With a mental illness, you do not see inside the brain. It's hard to diagnose and hard to understand, but, one thing I'm grateful for is that you guys take this webinar and take it in stride and make the small changes that are necessary. And change is not going to happen overnight. We all understand this. If that was the case, the world would be a Brady Bunch episode and everything would be happy within half an hour. Unfortunately, life is not like that. So what kind of factors play into mental illnesses? Does anybody have any ideas? So factors, we have physical, as it's talked about. See, a lot of people are typing. Thank you for that. I like interaction. Genetics, emotional, yep. Hereditary, family, poverty, yeah, that's a good one. So we have social factors, financial, environmental, sexual, spiritual, emotional, intellectual, and occupational. So when we talk about what influences mental health, any of these factors could be, an influence for negative or positive mental health. Every individual is influenced by many factors. These include or are not limited to the factors listed on the slide above. So think about what you eat and how physical activity affects how you feel. It releases endorphins and things like that. It can be a stress reliever. Often people use that as a positive coping technique, which is great. That doesn't work for everybody though. So I want you to think about different social interactions that you've had with, your coworkers, patrons, things like that. And if it was a bad interaction, how did you feel afterwards? Think about financial situations and how that can cause somebody to be dealing with extreme stress. And also think about how somebody's spirituality or spiritual experiences can make them feel. All these factors are interrelated to mental health. For persons coping with a mental illness, there might be times of severe illness, but there can be periods of stability. The goal for somebody living with a mental illness is generally to reach a period of stability and maintain a time of wellness as long as possible. That's that recovery position that we talked about. Although some mental illnesses are chronic disorders, such as bipolar disorder and schizophrenia, in such cases, periods of increased stress can elevate the symptoms of the disorder and lead to episodes. Psychosis, as defined by schizophrenia or schizoaffective disorder, is not a constant state. I want you to know that it's episodic, and one small thing can trigger an episode. So it's not lifelong, it's not chronic, but it's episodic. You can live with psychosis-induced bipolar disorder your whole life, but your periods of psychosis will only be episodic. And you may have individuals who use your libraries who suffer from a severe mental disorder. Look at them as a person, not as a label of their illness. With careful attention to treatment and prevention, persons with mental illnesses can lead full, productive lives and reduce the severity of their illnesses by taking advantage of all the proven ways to be healthier, including medication management, therapy, alternative therapies, healthy eating and exercise, establishing healthy sleep and daily routines. Now, we're going to talk about briefly resources. Not everybody has adequate means to get these resources. They do not have, the financial means. They may not be aware of the resources. That's where libraries as an educational source come into play. And since we have trained the Muncie Public Library staff on mental health first aid, our incident reports have decreased by 200% because people are now able to get the appropriate resources that they need. We can point them to people that can help them. So consider the following. One of the greatest challenges for persons with mental illness is stigma. Stigma can lead to prejudice and discrimination and can prevent persons with mental illness from seeking the help they need. When we hear stories in the news and media of stereotyped persons with mental illness are dangerous, that is the stigma. That is completely inaccurate. There is no greater percentage of violent behavior among persons with mental illness when compared to the general public. Stigma can manifest itself in avoidance of a person. When coping with a major mental illness, it's harder to talk about it, and often not viewed as socially acceptable to talking about a disease such as diabetes, heart disease, or cancer. So, do you know what to do if you found a coworker crying at her desk? What about if an employee comes to work smelling of alcohol? A colleague seems overly anxious. How do you respond? Do your staff know what to do? Does your organization have a policy or guide or guidelines to guide your response? 42% of people living with mental illness say they've been stigmatized for having such an illness. 58% of people said the stigma associated with their mental illness is more damaging than that of the illness itself. And 63% of people living with a mental illness said the relationships have suffered because of the illness. As important community centers, libraries have critical roles to play in educating consumers and fighting stigma. So let's discuss some of the ways mental health has been addressed in our communities through our libraries. Public libraries have become informal day shelters. 42%, let me clarify that. That's actually a good question or statement. 42% is those within the last year that are diagnosed with a mental illness. If we do not have numbers report on those who have a mental illness that have not been diagnosed. So the 42% is only within the last year of people who have been diagnosed with mental illness saying or reporting that there is a stigma. I hope that answers your question. But that's a good point. 42% is actually really low. But when you take into consideration it's only for people who have been diagnosed, it's actually a fairly even number. And yes, I realize 42 is actually an even number, but that's besides the point. Many of the everyday people who visit your library may have symptoms of mental health issues and substance use disorders. Certainly, many of those who fall into the homeless population will not have adequate access to the resources in your community. And libraries are becoming health navigators for the communities because of their ability to assist hard-to-help people with a variety of mental health issues. Now, that's not to say you have to intervene every time. We try to follow 3 guidelines. Are they a threat to themselves or others? Are they being disruptive? Or are they being aggressive? If they're not any of those 3, we tend to leave people alone and just kind of monitor how their behavior is going. But we always want to ask them, are you doing okay? Can we help you find something? Just to show that, yes, we're watching, but at the same time, we're trying to help you if, you need something. Why don't people seek treatment for mental health issues? We talked about a stigma earlier, so that's certainly one of them. But what are some reasons why people won't seek mental health issues? No insurance, yeah. Ashamed, yeah. Cost, definitely. Time, yeah. Denial, judgment, yep. So we have stigma. Many people are not well informed of mental health issues. It wasn't until I finally told my father, I feel broken, I feel something's wrong, and he was like, okay, let's go to the doctor and find out what's wrong. He didn't know what anxiety was. He didn't think kids could have anxiety. People often don't know how to respond. There's a denial that the problem exists. You don't walk into a room and go, is there a doctor who can help me with my anxiety? You tend to, bottle up, keep it to yourself, only tell your supports. Professional help is not always on hand. We have lack of local resources and lack of means to obtain help. That follows, even if you have insurance, it can be expensive. You have, drastic co-pays. Some things are not covered, things like that. So some other barriers that exist when trying to get access to mental health services: cost, belief that treatment won't help them, time, as we said earlier, unfamiliarity with services and resources around you, stigma, navigating insurance, confidentiality, medication, transportation. Yeah, thank you, Janice. And even if you're successful at getting help, there are hoops that you have to jump through. You have, do you have time to go to your weekly talk therapies if that's what's right for you? Getting the right medication, because that takes time. It doesn't click, as Diane was saying. Medication is a guessing game. And so it's very hard, to get the appropriate treatment, because sometimes it takes months, maybe even years. Only 41% of adults with diagnosable mental health problems and less than 20% of children and adolescents receive needed treatment in the past year. So 41%, that goes with the 42% of stigma, people who associated mental health with stigma. So only 41% of adults that are diagnosed with a mental health illness in the last year received help. So less than half. So why do we need to talk about mental health first aid? I'm going to set the stage with some general mental health facts and statistics. 1 in 5 American adults have mental illness. Mental illnesses are the leading cause of disability worldwide. 1 in 10 full-time employees has an addiction. 40% of employees with a mental illness take time off of it up to 10 days a year. More than 35% of managers feel they receive no formal support or resources to help employees. HR managers know the toll a mental illness can take on a company, yet only 15% feel managers are trained to recognize problem and share support and resources. Nearly 60% of adults with a mental illness do not receive mental health services in the previous year. Nearly 50% of youth aged 8 to 15 didn't receive mental health services in any previous year. African American and Hispanic Americans use mental health services about half the time Caucasians do in the past year, and Asian Americans are about 1/3 that rate. So there's cultural awareness we need to be aware of. And oftentimes we have, these stigmas and stereotypes about certain populations that, they refuse to acknowledge that mental health exists. I taught in China for 6 months, and I had a student that was showing clear signs of psychosis, and I told him, hey, maybe we should, talk to the school counselor about it. And he says, oh no, we don't talk about things like that here. And I was just kind of taken aback, like, what do you mean you don't talk about it? And he goes, you deal with it on your own. Just ignore that it exists. And that was really eye-opening to me, where I just, based on my privilege, I was like, well, everybody should be able to get the help they need. And that's one reason I think mental health first aid is important, because while you can intervene early, maybe teaching positive coping techniques can keep them from preventing to have to go to the doctor quickly or get into that medical crisis. U.S. adults with a mental disorder in any 1 year. Anxiety disorder is 18.1% of adults. Major depressive disorder is 6.8%. And if you take a look down to the penultimate row, there's schizophrenia, 0.3 to 0.7%. Less than 1% of American adults live with schizophrenia. And yet it's one of the most, I'm going to say, quote unquote, common or most prevalent disorders because the media plays into it. All our horror movies that we're watching have to deal with schizophrenia or borderline split personality disorder, but they portray them inaccurately. Are you including? Actually, Carrie, that's a good question. When we talk about addiction or substance use disorders, it's mostly illicit drugs. However, marijuana is still included inside that that category because it's not legal in all states. Caffeine and nicotine can be included, especially the use of tobacco. However, caffeine is usually neglected in the DSM-5 because it's a very common thing. And unfortunately, I hate to say it's like alcohol. Even though alcohol, you can have a substance use disorder, caffeine's usually neglected out of that. 8.1% of the population over the age of 12 have a substance use disorder in any given year. The use of alcohol or drugs does not mean a person has a substance use disorder. If somebody has a drink on a Friday night, after a hard week of work, that doesn't include a substance use disorder. It's when the dependency gets to the extreme. 75% of people who develop substance use disorders do so by the age of 27. And alcohol use disorders are almost 3 times as common as drug use disorders. Heather, the percentage, the less than 1%, the 0.3 to 0.7 is only the correct diagnosis. And yes, there are the misdiagnoses of schizophrenia because it's very difficult to fully diagnose, especially because it is episodic. But that's a great question. As I said earlier, only 41% of people with a mental illness use mental health services in any given year. So mental health in your community. 42.5 million American adults are affected by mental illnesses every year. People living with mental illnesses are 16 times more likely to have law enforcement problems. 18.5% of American adults have at least 2 diagnoses, so we have that comorbidity rate. And despite being the lowest occurring mental illness, schizophrenia and other psychotic disorders affecting less than 1% of the population.
Hey, Lauren.
Whether a yeah.
There is a question about over here in the chat box about the percentage for schizophrenia.
Uh-huh.
Heather Tackett, She said, does the percentage for schizophrenia include the number of misdiagnoses or confirmed schizophrenia?
That's only for the confirmed schizophrenia, because the misdiagnosis will actually fall into a different category under dual diagnoses until it's appropriately diagnosed.
Thank you.
No problem. Whether a person has a mental illness or not, one does not just snap, as often as people report in the media. There's generally a progression of behaviors down a pathway towards violence, and those behaviors often become noticeable as a person moves down that path. Remember that not just the homeless and the poor suffer from mental illness. Mental illness has no racial, economic, or intellectual boundaries. You may be too busy at work to spend a lot of time with any one person, with a mental illness or not. Many people who you consider quote-unquote strange have a right to seek your services and have a real need that you can meet within your job description. But try to limit your interventions to relatively short periods of time. But realize that taking the time to try to communicate effectively with a person may save you a lot of time in the long run and help someone in the process. That's where early intervention is strategically helpful. And when you're dealing with somebody who has a mental illness, you're going to have emotional responsiveness. You're going to be exhausted afterwards. It's common, and guilt is a natural feeling that we all have as humans, and it's okay to feel guilty that you couldn't help them or you couldn't do more. And so, you need to take into account your mental health as well. And especially if you're a supervisor or even a coworker, if somebody's dealing with a difficult patron and you can see it straining on them, you can step in and help them. Or after the situation's over, ask them if they're okay, if you can do something for them. Compassion fatigue. Yes, exactly. So why mental health first aid? Mental health first aid teaches you how to identify, understand, or respond to signs of mental illness and substance use disorders. The training will give you skills needed to reach out and provide initial help and support someone who may be developing a mental health or substance use problem and experiencing a crisis. Without early intervention, there's poor long-term functioning, increased risk of depression and suicide, strain on relationships, and subsequent loss of social supports. We have disruption of education and employment, increased use of alcohol and drugs, loss of self-esteem and confidence, and greater chances of problem with the law. Mental health first aid matters. If we see somebody unconscious on the floor, we know at the very least call 911, and if they're not breathing, start CPR. But most people don't know what to do if somebody's having a panic attack, or if someone's showing signs of alcohol substance use disorder. How many of you have heard that somebody's having a panic attack, make them breathe into a paper bag? Yeah, heard it and hate it. So when you exhale, you're exhaling carbon dioxide. So when you're holding that into a paper bag and you're just rebreathing that, you're only adding to your experience, your signs and your symptoms of a panic attack. You're getting lightheaded, you're getting dizzy, you may be getting nauseated. So forget the paper bag, throw it away, use it for your lunch. Sit there and have them modulate their breathing. When we deal with kids that are having, anxiety or hyperventilating, we give them little bubbles so they can sit there and blow bubbles, because you can't hyperventilate and blow bubbles at the same time. So with kids, it works. I want to caution you on using expressions that do not put people first. When talking with somebody, we often ask, "How are you?" Or "Are you feeling okay?" "Can I help you?" These are some of the general ones that we ask. We put the focus on how the person is feeling and how we as an individual can help. The same sense of person-first language should be used when dealing with those with mental illnesses. Avoid expressions like, "Oh, he's a schizophrenic," or "an alcoholic." Replace them in favor of phrases such as, "a person living with schizophrenia," or "an individual with alcohol dependence." Every individual is much more than their illness. Illness does not define a person, so we should be careful with our discourse, our language, and our expressions when revealing that information. Making the shift in expressions to avoid calling someone a schizophrenic or an alcoholic, a bipolar, in favor of a person with schizophrenia, a person with alcohol dependence, a person with bipolar disorder, empowers the individual to be so much more than the disease. While this transition takes a lot of time to develop, And we will have slip-ups. It's important to be cognizant of how we approach people. Many words we use are colloquialized, have ingrained themselves in our society and our everyday language. How often do you hear the word crazy used in casual conversation? According to a recent study by the National Alliance of Mental Illness, on average, the word crazy is used 14 times per day per person. Using that kind of language sends the message that it's okay to trivialize mental illness and lazily substitute real people's lived experiences for wild, silly, dangerous, or out of control. If you mean to say, that's unbelievable, just a simple change of your language can help destigmatize mental illness and reduce the effects of casually ableist expressions. I still use the word crazy, and I've been teaching mental health for almost 3 years now. So even as a national instructor, I use the word that I'm not supposed to use. So it takes time, but I like to use an oops, ouch rule. So if you say something that you really realize it could be ableist or offensive, you can say oops, like, I should say something more positive and repeat what you've said, but changing those words out. And you can apologize for your behavior because you're working on it. And we've actually implemented that in our library. And even just casual conversations saw a decrease in stigmatizing language. Employer costs. And I know as an HR professional, one of the things we have to look at is budgeting, health insurance, things like that. So we're all familiar with, the tip of the iceberg. So we have medical, mental health, substance abuse, pharmacy, and disability. That's what we see. But underneath, we have presenteeism, loss of productivity, absenteeism, overtime to cover sick day absences, overstaffing temporary workers, recruiting costs, retraining. So be aware that emotional responsiveness plays a large role in positive mental health. How many times does a staff member have to deal with a disgruntled patron? How many times have you seen a staff member stand at their desk and take all the ills this patron is dishing out just to turn around and act like it doesn't bother them? I've seen it more times than I would have liked to. As previously shown, 40% of employees with a mental illness take up to 10 days off a year because of it. However, even employees without a mental illness are known to take up to 5 days off per year for a mental health break. The loss of productivity when employees have to take time off of work, it adds up. The indirect cost of mental health ranges from $80 to $100 billion annually in the United States. We can begin to combat that by asking staff members if they're doing okay after having to deal with something difficult. A simple use of an I statement, such as, I noticed you seemed upset after that interaction. Are you all right? Or, I want you to know that I'm here to support you, can actively change the perception of the employer-employee relationship. So we took a survey as Muncie, and so do employers promote a mentally healthy workplace? For libraries, less than half of all staff, management professionals in both technical and non-technical say their employees promote a mentally healthy workplace culture. Okay. As this graph shows, those in higher positions, senior executives, executives in general, believe that they are promoting a workplace that is mentally healthy. Supervisors, managers have confidence in their knowledge and abilities. 81% of managers feel comfortable discussing mental health with their staff members, which is good. The same 81% feel they could direct staff to appropriate supports. Also good, being aware of what resources that you have. However, employees disagree. 29% believe their manager is knowledgeable about mental health. 32% would not feel comfortable talking to their manager about a mental health issue. 26% agree that the supervisor is able to effectively manage mental health issues. And 32% feel that the supervisor would not be helpful if they were to approach them about a mental health issue. A positive workforce culture can help alleviate everyday stressors and anxiety about work. Ask your staff what they would like to learn more about, rather than assigning them workshops they may not feel address certain issues. By bringing staff into the conversation of what they're seeing and experiencing, you can make an appropriate, informed decision about further trainings. 44% of library staff nationwide between 2016 and 2017 say they received no training or support for mental health issues. 33% said they're up to date of knowledge on internal and external support systems and resources. 32% of supervisors know what guidelines to follow if a direct report has a mental health issue. 18% of library staff have received training on how to recognize mental health issues in employees, and 17% of staff had training on how to have conversations with employees regarding their mental health. So, it's nice to see that we are getting trainings on mental health, how to address these issues, but it's not enough. Just because you receive the training does not mean you've employed it. You've not implemented it. You're not actively working on it. So additional trainings staff would like to see: recognizing signs and symptoms, community supports, softer skills, responsive to negative reactions, that compassion fatigue we were talking about. So here are a few suggestions from staff trainings I received during mental health first aid instructions for libraries and other public resources. Not every community will have the same needs, but by bringing staff into the conversation, you can gain insight onto the inner workings of what your library is needing. Work with your administrators to have an institutional plan, and make sure everyone, including volunteers, knows what to do if you address a situation with somebody experiencing signs of mental illness. So, knowing that library school may not have prepared you for this, be sure to work with your administration to develop a plan. Being proactive is better than being reactive. You need more than just a plan through. Keep the dialogue going. Ensure that everyone is comfortable addressing the issues and affect your particular library. One of the hardest questions people have a hard time asking is, are you thinking about suicide? Do you have plans for suicide? Nobody ever wants to deal with that taboo issue. But oftentimes people with mental illness, when they're hitting a relapse phase, 33% of people will attempt suicide. So even as just a coworker, a family friend, a mentor, a volunteer, if you see somebody that has been going through recovery, is working on their mental illness, and they're having a hard time, they're hitting that wall, and you're noticing like, hey, this is not something that they should be doing or that's out of the ordinary for them, ask them the question. It's going to be hard, it's going to be emotional, but I'd rather have somebody upset with me and alive for asking the question than dead. So we talk about benefits coverage a lot in HR, what our insurance covers. Does our insurance actually cover a lot? Benefits have been expanded. The Mental Health Parity and Addiction Equity Act and Affordable Care Act have expanded mental health benefits. We have EPAs. By employer standards, it's inexpensive, but it's often underutilized. Just because some people are not familiar with mental health parity, it means that insurance benefits for mental health and substance use conditions are equal to the coverage for other types of health care. So let's say, for instance, your insurance plan offers unlimited doctor visits for a chronic condition like diabetes, then it must also offer unlimited visits for a mental health condition. I often get asked, does my plan have to follow parity? The federal parity law establishes minimum standards across the country. If a state has a stronger parity law, health plans must follow that state standard instead of the federal one. And as you can see, the EPAs are underutilized in the workforce. However, we combat this by making sure our staff are aware and comfortable with coming to someone to talk about their mental health status. If we intervene early and teach positive coping techniques and prevent people from having to see a medical professional, we are being proactive in the mental health game rather than being reactive. So who are first aiders? First aiders are lots of people. Librarians, teachers, first aiders, responders, veterans, neighbors, parents, friends, HR professionals. They're people in recovery, supporting those of family members. They're first ladies and mayors. And mental health first aiders are anyone who wants to make their community healthier, happier, and safer for all. Mental health first aid is Be the Difference. That's their hashtag. Because mental health first aid can be applied to anyone, anywhere, at any time, for any reason. So what do first aiders do? First off, they create positive change in organizations, focus on education and communication to reduce fear, stigma, and discrimination, create a culture conducive to good mental health, demonstrate leadership from the top down, and provide tools and training to support their staff. Mental health is how we think, feel, act as we cope with life. It also determines how we handle stress, relate to others, and make choices. Like physical health, mental health is important at every stage, from childhood and adolescence through adulthood. Staying mentally healthy is not always easy, especially during tough times. Some tips I would like to give you: get support from family and friends. And I know sometimes if you just moved, extenuating family circumstances, that may not be possible. There are people there to help you. 7 Cups of Tea is a great app. You can always text HOME, HOME, to the number 741-741, and you can talk to a support member via texting for as long as you would need, and it's free of charge. Standard messaging text rates apply. Also, find time to take care of yourself and relax. We always talk about, like, self-help. Some people like meditation, some people like exercise. I like to bake and pet my dog, not at the same time because that's a health hazard, but find time for yourself. Find time for something that you can relax and enjoy without, overly stressing yourself out. Have a healthy lifestyle with regular exercise if you can. It's also important to recognize when you may need help from a professional. And it may be hard to acknowledge that, to fully embrace that, okay, it's time for professional help. But the sooner you can get that help, the better off you will be. And it's going to be hard, but know that people are here for you no matter what. And also recognize that mental disorders are common, treatments are available, and just because some person is having a bad day does not mean that they're having a depressive episode or something like that. Just because you have an off day doesn't necessarily put you in the category for mental illness. So I want to give you a few take-home points before we open up for questions. Fight the stigma. Be proactive about your own mental health, because if you can't take care of yourself, you can't take care of anyone else. Cultivate your knowledge of mental health resources in your communities. Do your very best to assist those with mental health issues, and if you are uncomfortable, bring somebody else in who can. We use the buddy system at the library. That way there's 2 people always in the same room that can help the person in need. Keep the dialogue going at your library. Bring up points that you're confused about, or that you would like to see change, or future trainings you would like. And make a plan at your library. How would you deal with mental health issues? How do you help co-workers versus patrons? There's going to be different situations and scenarios, and it's good to have, at least a basic guideline for those. Thank you, and if there's any questions, I'm more than happy to answer them with the time that we have left.
Thank you, Loren. That is very helpful and very valuable information.
Well, I'm glad I can help, and I hope, I know it's a lot of statistics, but if you take away one thing from it, I did my job.
Looks like several people are typing, so we'll wait and see what they say.
Do you know of any other resources textable for people besides home? Yes, you can actually text CONNECT to 82355, which is the National Suicide Preventative Hotline. Or you can actually go, if you go to an internet search browser and type in National Suicide Prevention Lifeline, they have an online chat feature as well. You're welcome, Robin. Sandra, that's actually a really good question. The most recent statistics, unfortunately, we have is from 2013, and upwards of 78% of displaced individuals, homeless individuals, will live with a mental illness. Just because you use a stigmatizing word, not to call you out, but it's a teaching moment, the word suffer is negative, so if we say live with, it might be easier for people to be more comfortable to talk about. Seasonal affective disorder, that's actually a really good one because that is a mood disorder. And if they live with a seasonal affective disorder as well as depression, one thing is to find something that makes them comfortable. First off, uh, my fiance has a seasonal affective disorder, so winter is a very hard time. They like to play video games. And some people are like, well, video games, can add to certain things, but that's also a brain stimulation. So find something that they like to do to get them active, and that doesn't mean you have to get outside. Just be active for a little bit, and then oftentimes people who are more active are more likely to talk to somebody about how they're feeling, and then you can get more information to go forward with treatments, talk therapy, something like that. Depression and loneliness among elderly special. Yes, the 7 Cups of Tea has an older adults, I'm going to call it a module, for lack of a better term, where they specialize in people 65 or older that are lonely, have depression, and things like that. Yes, Debbie, Indiana has 58 mental health first aid instructors, and if you go to mentalhealthfirstaid.org, you can actually find a course or an instructor who will be able to teach the mental health first aid course, and you'll get certified, and it's good for 3 years, and it's already blanketed across Indiana for LEUs, so that's always a good perk too. Yeah, sometimes people just want somebody to talk to, and if you have the time and you even for a couple minutes to be that person for them, that can turn their day around and actually help alleviate anxiety and stress and some of the loneliness people have. Yes, Heather, people are moving away from LEDs and LCD lights, but they have a new blue UV lighting that helps for seasonal affective disorder, and you can actually get the lamp itself plus the bulb on Amazon for about $30 right now. How to deal with seasonal affective disorder in the workplace? Good question. I know replacing a lot of light bulbs is very expensive, but if there is a way that you can have maybe a desk lamp, that helps some people. And if I know I have a coworker that likes to play music because it helps calm them down and affect their mood, bring it up. And so if it's appropriate, they can play music that might help. And excuse me, it's difficult for seasonal affective disorder in the workplace, but there are ways around it. I think the desk lamp is the most beneficial because they can adjust how bright it is, where it's pointing, things like that. We actually, one of our local partners, Muncie Outreach, oh, don't worry, autocorrect is a terrible nightmare sometimes. Muncie Outreach, we have a mental health recharge. So we teach them coping techniques, tell them that the feelings are valid because all feelings are valid. And you always want to validate feelings and experiences rather than, if somebody's having a psychotic episode, their delusions are not valid because it's a loss of touch with reality. So always affirm that what they're feeling is valid and you're here to help that feeling if you can. So I think with teens, it's more appropriate to give them more coping techniques, and oftentimes you're going to have that hard connection where, how do I relate to them? So one thing I like to talk about is I get to know them a little bit. Fun fact about them, what's their favorite music or what's their favorite movie? And then one thing they like that relaxes them. I had one adolescent guy said, I like to go to the boxing ring. And I'm like, okay, that's great. Like, what do you like about that? And he goes, I can get out my aggression in a safe environment. And so maybe it's about finding them a resource where they can do that. And I know some communities have low cost to free exercise facilities and things like that that might be beneficial to them. But that answers your question. That's actually a very good question to help an employee crying at their desk. Yeah, sometimes you offer them to go home, so they can recoup, things like that. But as you said, they may feel lonely or worse at home. what we like to do is take them into a safe spot, so that be a quiet study room, HR office, and have them talk with somebody that they're comfortable with. I had a coworker that was like, I don't want to talk to you, I want to talk to a guy. And so we brought in one of the male coworkers, and it was easier for them. It's a safe accommodation that they can talk about how they're feeling. And if you don't even get to the root of why they're crying, just giving them that time to be heard helps them feel that they're valued and that they're important and somebody believes in them. So I think it's one of those things where you have to take it situationally, but if they feel worse at home, let them stay at work. And if there's an accommodation you can make where they do clerical work, behind the scenes or something like that, that might be one way to address that. You're very welcome.
I'm going to go ahead and post the link for you to download your LEU certificate. It's on the screen now, so you should be able to download that. Thank you, Lauren. This has been very helpful.
Oh, you're welcome. If you have any questions, Kara has my contact information, so you guys can email your questions at any time.